So blood is basically an organ of the body. However, this organ flows through every part of our body. Blood constitutes the RBCs, the red blood cells, the WBCs, the white blood cells, and the platelets. Each of them have specific functions. Apart from that, blood also helps in transfer of nutrients, right? So when we talk about the three components, it is also important to understand that each of these components have a different role to play in the health of the human body. The red blood cells are very important in carrying oxygen from the lungs to various parts of the body, and they help to nourish the cells so that energy can be produced. Then we have the white blood cells. White blood cells are very important to protect our body from outside sources which can damage the body, or even the damage to the body from inside elements. The platelets are important to make sure that too much blood is not lost when your body or your skin gets injured. So these are the three components of the blood and their functions. So let us understand what is blood cancer. Blood cancer is a generic term. It encompasses the cancer which affects the three cell lines, as I have told you. All these three components of the blood are produced from our bone marrow. Bone marrow is the factory of the blood components. So what happens is, in the bone marrow we have certain mother cells, or stem cells as we would like to call it, who are omnipotent. That means they can either form RBCs, WBCs or platelets. They all depend on certain factors inside the bone marrow which make them mature into either of these three components. So when these stem cells or the intermediate cells are damaged through some chemicals, radiation or some other genetic factors, then they form the cancer of these blood components. So it is very important to understand that all of these cancers basically have one genetic damage which leads to multiple other genetic damages, after which these normal stem cells lose their normal function and they become abnormal. So basically cancer is a normal cell which has gone rogue because of damages that have made it lose their normal function. That is what cancer in general is. Now these stem cells have various other factors or characteristics. One major characteristic is they will continue to replicate without any break. They will continue to invade nearby normal organs and destroy those organs. Third is they will cease to function as cells in the body which are known to have some specific advantages in our body. For example, the white blood cells will stop behaving as protectors of our body and they start damaging our body, right? So this is what blood cancer does. So is blood cancer only one type? No. Just like we have three components of the blood, we have various types of blood cancers. Blood cancers, in my opinion, can be broadly classified into lymphomas and leukemias. Lymphomas are the cancers of lymph nodes. Lymph nodes are nothing but those checkpoint areas in our body which are serving their own organ, which help to protect the organ from outside damage. For example, if you have a stomach and then you are daily eating into your stomach, these lymph nodes which are surrounding the stomach will help to protect your stomach from all those toxic substances that which are maybe accidentally ingested by an individual. So just like that, lymph nodes are there surrounding every organ in our body. So when these lymph nodes, which are basically made up of multiple WBCs, get damaged, these lymph nodes start attacking the same organ that they were actually made to protect. So lymphoma is the cancer of the lymph nodes and the lymphatic system in general. Whereas leukemias are the traditional blood cancers. Basically, this is the abnormality of the blood components which makes it difficult for the body to function normally. For example, you have four major subclassifications of leukemias. You have the acute leukemias, which are then subdivided into acute myeloid leukemia and acute lymphoblastic leukemia. Then you have the chronic leukemias, which can be then divided into chronic myeloid leukemia and chronic lymphocytic leukemia. Let me go to the latter. The chronic leukemias are highly controllable. An example of that is chronic myeloid leukemia or CML, in which you will find that patients with adequate therapy can be treated for a long duration and patients can live a good quality of life. I personally have many patients with chronic myeloid leukemia who have lived for excess of 10 years, and internationally we have a lot of patients with chronic myeloid leukemia who are now living beyond 20 years. So with advanced therapeutics, today chronic myeloid leukemia has been rendered similar to diabetes or hypertension because of the benefit of the drugs that have been invented and discovered in the past few years. Same goes with chronic lymphocytic leukemia. Even this entity, even this disease was initially considered to be very difficult to manage, and now is a lot more easier to manage because of the availability of advanced therapeutics. So in summary, chronic leukemia patients can survive for many years. They can be cured if really required by bone marrow transplantation, but since the available medications allows this patient to live for more than 20 years in many instances, that is why it is basically relegated to the bottom with respect to chronic leukemias. Sometimes these chronic leukemias can actually assume an aggressive form, during which time bone marrow transplantation is offered to some of the patients. Let me talk about acute leukemias now. Acute myeloid leukemia is probably a very aggressive cancer in which patients, when not treated, can die within a few weeks. Even after the most advanced treatment that we have today, not more than 2/3 of acute myeloid leukemia patients live for a long time. The acute lymphoblastic leukemia are also aggressive leukemias. However, they are stratified based on the age of onset. When acute lymphoblastic leukemia occurs in infants or in younger children, it is extremely curable. If it occurs in older adults, then it becomes difficult to be cured. So, lot of advanced therapeutics are available for acute leukemias also. Many of them have revolutionized the way we treat acute leukemias, and they have enhanced the cure of acute leukemias. Let me give an example. Acute myeloid leukemia. In maybe 1970s to 1980s, at least 80% of the newly diagnosed acute myeloid leukemias used to not live beyond 2 years. Now, in 2020 and 2021, we are seeing up to 80% of the patients with best of the best therapies can live 2 years. Isn't that such a great change? And we also have great technologies available, such as the CAR-T technology that is really coming up, by which you can even convert many of these advanced leukemias to a chronic disease and sometimes even cure them. So that is the kind of impact that we are seeing today because of so much of research that is going on in India, United States, Europe and many other countries of the world. And all the countries are coming together to make sure that blood cancer is not as dreaded a disease as it is today. Now, is blood cancer curable? That is something that many patients ask us, doctor, you told me that I have blood cancer. Is it curable? My answer to them is yes, it is curable. It depends on the blood cancer type. It depends on the aggression of the blood cancer. It also depends on the type of therapy that is given for blood cancer. So many blood cancer patients survive. In fact, we have across the world blood cancer patient survivors meet, wherein we basically encourage many of these patients to come forward and share their stories and help encourage patients who are newly diagnosed with blood cancer. The treatment of blood cancer, in my opinion, can be divided into 3 major categories. In chronic leukemia, which is the chronic myeloid leukemia and chronic lymphocytic leukemia, it is targeted therapy. Either it could be tablets or it could be targeted injections. These targeted injections are otherwise called as monoclonal antibodies. When it comes to acute leukemia, again, like I said, It is basically two. One is advanced chemotherapy protocols and two is bone marrow transplantation. Bone marrow transplantation earlier days used to be called as stem cell transplantation. Now many of us call it as blood and marrow transplantation. There are various terminologies for it, but to summarize, the treatment of acute leukemias is the advanced latest chemotherapy protocol followed by bone marrow transplantation.